Sleep, we know it's important for everyone, but not everyone is getting enough of it. And for some people, that's a matter of dentistry. I want to get into this today and help you holistically, possibly identify what might be causing your sleep issues or maybe your kids' sleep issues. And Dr. Yuliya Rabinovich is a dentist. She takes a whole body approach to dentistry with the focus on sleep and airway. And doctor, I don't think a lot of people associate their sleep issues with their teeth or their mouth.
Correct. Unfortunately, it's a domino effect as most of our bodies work. It isn't just that one thing that causes everything else. It's a chain reaction. And so a lot of the times there could be different reasons for sleep apnea, but a lot of the times by definition, obstructive sleep apnea means that there's something obstructing your airway and prevents proper exchange of air. And so the obstruction could happen anywhere. It could happen behind your tongue, it could happen behind your soft palate, or it could happen in your nose. And so the key to most things is getting to the root cause and trying to figure out why there's obstruction or why there's an sleep apnea.
I'm really curious how you got into this. I don't, I go to the dentist, we all go every 6 months, but I never would think of my sleep issues. Like I mentioned a minute ago, a dentistry issue. How did you as a dentist is it very common to have dentists that focus on sleep issues?
Unfortunately not. This is not part of dental school curriculum. I had to really dig around and learn more about this. And it was because of my kids, my oldest actually. And since necessity leads to innovation, being a mom to three and my oldest really struggling to breathe at night, I would witness her not breathing at night. I really had to find a way to help her. And unfortunately, the most common channels of seeing ENTs and pediatricians didn't give me the answers or offer treatment. So I needed to find answers as a mom. And as a mom, I was digging around. And as a professional, I was hoping to find some answers on dental websites. And I found it. I found it in a class that changed my life, the life of my kids and even my career.
Wow. Okay. So you took this class and what did you learn and how did you start implementing that in your practice?
So the interesting tidbit, it was actually the anthropologists who started sounding the alarm. They would dig up skulls and study them. And what they found was up until 400 years ago, humans had really pronounced jaws, all 32 teeth in perfect U formation and no orthodontist. Now orthodontists are booked months in advance. Nobody can fit their teeth in, and we're pulling third molars or wisdom teeth out because we don't have space for them. Everyone is crowded. Every parent knows they're going to have to put some money aside for orthodontic treatment. And so they needed to look at what is happening. And what they see historically is industrialization. We started mass producing things, baby bottles, baby food. We're just not exercising our jaws the way that we were meant to, or the way our ancestors did. And so the chain reaction of that is smaller jaws. But the soft tissue that we have in the mouth are still the same size. So it's just not fitting into our mouths anymore. So a lot of us approach it, oh, we have too many teeth. Let's straighten them out, or let's pull some and make space for them. But let's turn it upside down. The teeth are fine. We have the same number of teeth we've always had. We just have smaller jaws. So we just need to grow and expand that. And that has a chain reaction of being able to breathe better, not having that soft tissue obstructing the airway, and of course, straighter teeth.
So what do you do? So people will come to you for general dentistry, but also because they're having sleep issues and they want to know if you can help them where another doctor might not be able to. So how do you analyze that? What are you doing in your office when someone comes to you with sleep issues?
Well, proper workup is the key. You definitely want to test first, get the answers as to why somebody's having bad sleep issues. It may not always be obstruction. So we take a sleep test, we take a diagnostic 3D scan, we do a thorough exam, we take history. We ask patients about being breastfed, even if they're in their 60s. We talk about patients, whether they had orthodontic treatment, anything related to the mouth, if they had, believe it or not, frequent ear infections in childhood, if they grind their teeth, all of it is related. And all of it has a reason for it. And so once we take the diagnosis, then we can figure out how do we proceed for that. There are several options. Of course, the medical community considers the CPAP machine as a gold standard to treat sleep apnea. And that's great for severe cases. The problem with CPAP machine is that not everyone can tolerate it, unfortunately. The other issue, it's been shown that sometimes over time, CPAP machine efficacy decreases because there's only so much you can force that air through the tissue before it completely collapses and obstructs the airway even more so. And so the other options become an oral appliance. So the simplest one is an appliance that just pushes your jaw forward. They're called MAD, for mandibular advancement devices. Those are great, they do work, but they don't address any soft tissue that could be obstructed behind the soft palate, just the jaw. So in which case, and that's my personal preference, and that's what I'm treating myself and my husband with, and that's an expansion appliance. So it expands and it grows the jaws and thereby grows the airway, but also moves my jaw forward because growth takes time and I need to be sleeping and breathing better yesterday. So it does move the jaw forward to help with that, as well as expanding and growing my airway at the same time.
And what is a device like that? Is something that you wear all the time or when you're sleeping?
So definitely when you're sleeping, and you do want to wear it during the day as well, because if you don't wear it, it's not doing anything. So the goal is to wear it for at least 14 hours as an absolute minimal. It doesn't have to be consecutive, aside from the night. So an hour here, an hour there, as long as it cumulatively adds up to at least 14 hours, it does expand the jaws somewhat. And think about it. We're talking about a two-dimensional expansion, right? If it expands this way 1 millimeter or this way 1 millimeter, but when it accumulatively, when we're talking about volume, it's a much bigger difference volume-wise. So that's how by moving everything forward, you're just opening up the airway.
And is that pretty much a fix for a lot of people?
It's an improvement for a lot of people. It's hard to call anything a fix in medicine. Plus, when it comes to compliance and having to remember to wear and being dedicated to the cause and when you ask patients to work for it, the compliance always decreases. So we have to take that under consideration. But any growth or any expansion, or even just simply by moving the jaw forward, it will improve sleep tremendously. How much is very individual.
Yeah. What are other issues that you find? I know I remember my dentist telling me once, I think you grind your teeth. I was like, I do? Like, what are other issues that people have? I had no idea that I was grinding my teeth, and I think I sleep pretty well. But sometimes you're not getting the deep sleep that you need.
Right. Well, I've always slept really well. I've sacrificed my teeth for it, but I slept really well. So the question becomes, what could be so important that your body is willing to destroy part of it, as in teeth? Well, breathing. Breathing is pretty much up there on the list of really important things to be able to do well. And so we grind our teeth, and there are two reasons for it. There's some studies show that by grinding, you're contracting all these muscles here that open up their airway. And also by grinding, you're moving the jaw forward to open up that airway in the back there. So it's a defense mechanism. It's a protective thing that we do when the brain goes into panic mode if we're not getting enough oxygen. So that's one of the first things that I look at during my exam, is to see if there are any signs of attrition or grinding on the teeth. The other one would be if a person comes in and says, oh, my tooth here broke. Well, why did it break? Do you grind? How much you grind? I also take a look at the tonsils. Are tonsils enlarged? If the tonsils are enlarged, and a lot of the times I get the response from patients, oh, they're always been big. Well, why was it always big? Were you a mouth breather? Because we're not designed to breathe through our mouths. Being able to breathe through the mouth is a wonderful alternative for the times that we're congested or we're sick, but that shouldn't be the primary way to breathe, because we have this wonderful, beautiful filtration system set up in our noses. We produce nitric oxide that helps filter the air. It kills bacteria, mold, even viruses. There was a big article on how nitric oxide can kill coronavirus, which was pretty impressive. Nitric oxide also helps lower blood pressure. So it's very important to have a properly functioning nose. But if we're not using our nose to breathe, we're not filtering the air, we're breathing through the mouth, that unfiltered air passes through the lymph tissue, which is tonsils, can lead them to being inflamed. If you're doing chronic cleanup, you're going to have chronically inflamed tonsils. And I've completely lost the track of thought.
Yeah, no, I think that was super interesting, though, how we should be breathing through our nose, you were saying. And a lot of people, you might wake up with a really dry mouth because you're sleeping with your mouth open. Right. And so you were talking about the importance of being sleeping with breathing through your nose. I know some people have
Correct.
enlarged tonsils and they're mouth breathers. And how would someone identify that? And I guess my question is more so like, I didn't know I was grinding my teeth. I thought I was sleeping pretty well. So, what are some of the telltale signs people might have that they could use your help?
So they're different. So for children, the questions that I usually ask: does the child have had frequent ear infections or ear tubes placed as a result of that?
Okay.
Does the child grind their teeth? Do they wet the bed way past the time that they're in diapers during the daytime? Do they wake up with headaches, groggy, irritable? All of that can sum up and make me think that maybe there's some airway issues. Enlarged tonsils, same thing. Um, if a child with primary dentistry, meaning with baby teeth, comes in and they have crowding, they have small mouths. They do not have big enough mouths to accommodate probably even the airway, but definitely not adult teeth. A lot of the times parents are very happy in how straight and together the baby teeth are. Same thing, not good. That means that they will not have enough space. Chances are they won't have enough space for adult teeth. And I'd rather address those issues with the littles sooner
Right.
rather than later.
Yeah.
With the little ones, it's really easy. There are growth guides available, and there's so many different companies out there. Vivos is the company that I deal with. There's Healthy Start, there's MyoBrace. There's so many different ones, and they're very similar. They look something like this. It's a little growth guide that encourages proper tongue position on top, and it does move the jaw forward a little bit, but this guides the growth of their jaws because they grow so fast. We don't have to do much,
Yeah.
just guide them. And my son stopped coming into our room 2 weeks after we started consistently wearing this appliance.
Oh,
So I know it works for him, which was great. With adults, it's a little different. We don't grow anymore. So we need that a little extra push. So we have different appliances for adults. It's an expansion appliance, something like this, that helps expand sideways, forward, and bring all the soft tissue with it out into the front.
it's just so interesting. I'm fascinated by this because I talk to so many people in the health industry and people who have sleep issues and they're trying different supplements or different routines. And it might just be physically something that's not allowing them to breathe well enough to sleep. Like I think it's a fascinating a specialty, I guess, if you could call it, or focus that you have. Well,
Correct.
anything else that you think would be important for people to know before we wrap up?
Gosh, I can talk for hours about this. I think I this falls into the category of you don't know what you don't know. So
Mhm.
for parents, have the conversation with your pediatric dentist. You don't know what they know. They might know more than you think. If not with the dentist, seek out airway conscious dentists. We're out there. We're coming up. People are learning more about airway. So dentists are becoming more aware of this. So seek one out to have this discussion and bring it up. If you have certain concerns about your child grinding their teeth, not sleeping well, restless sleep, showing up in your room
Mm.
at night, it's worthwhile a conversation. It's worthwhile considering it. The one thing that I would love for parents to start doing: stop cutting things up. Give them a whole carrot, give them a whole apple, get those jaws working, get them exercising. It's the muscles that will guide the growth of bone. So we need to start getting away from the soft Gerber baby food and start kids getting on normal human food, getting those muscles exercises. So I think that's a tip that I'm going to leave you
That's
with.
interesting. So just exercising, just like you everything you do everywhere else with your body, you need that exercise in your jaw. Wow. Fascinating. Doctor, thanks so much. I appreciate your time and I hope everybody got as much out of this as I did. I'm sure they did, and hope to talk to you again soon.
Thank you so much for having me. I appreciate it.